For those lucky enough to find one, having a nasal swab or spit return a positive result with one of these kits meant a long wait in a line at a government clinic until now.
If you have a positive RAT result, then you need to consider yourself a positive case.
To ease pressure on screening sites and free up staff, rapid antigen tests no longer need to be confirmed by a PCR test, with Canberrans instead to follow the instructions on the ACT COVID-19 website, even though health authorities currently have no way of recording those positive results.
It doesn't actually really require a notification to ACT Health for people to know that they need to isolate and do what they need to do.
People with compromised immune systems, pregnant women and Aboriginal and Torres Strait Islanders aged over 55 may still need to get a PCR test to ensure medical treatment is targeted. And the Chief Health Officer concedes their knowledge of who in the community is actually infected will be compromised.
But we're used to making estimates and predictions based on these uncertainties. We've been doing it throughout the pandemic.
What is certain is of those who lined up for a PCR test in recent days, 1,039 today became confirmed cases, with 27 now in Canberra hospitals, the highest number since the start of the pandemic.
We seem to have stabilised at around 1,000 to 1,200 per day. But I expect that as we start seeing our community come back into the ACT after holidays, that we will start to see that increase in daily numbers again.
It's a worrying thought for those whose young children will soon return to school. But from tomorrow, 5 to 11-year-olds will be able to get inoculated, with around a quarter of parents and carers for that age group having jumped at the chance and booked their kids in at a government vaccination centre in the coming weeks.
My 10-year-old is booked in for a vaccination first thing on Tuesday morning. Basically, as soon as I heard that the vaccinations for this age group were open, I hopped on the phone and booked her in.
And with just as many children expected to be vaccinated at GPs and pharmacies, around half of 5 to 11-year-olds will have at least some form of protection before returning to the classroom.
Every dose is important, and we will roll that out as it is appropriate and ensure that those children get their second dose when they are eligible.
Authorities say appointments are still available, and those who are uncertain should speak to their GP. Harry Frost, ABC News, Canberra.